jaw starts tightening and going sideways. A little while ago I was fine, you know, but now it's starting to leave again.
Does it hurt?
My back right now hurts, and the jaw and the whole neck starts hurting.
This is a man who came in complaining of involuntary muscle spasms.
Look at the camera.
He was not a psychiatric patient. After extensive questioning, initially during which he had denied taking any medicine whatsoever, he admitted that he took a medicine, but didn't know what it was, and he had taken it from his girlfriend, assuming it would help actually his low back pain.
Are you in
My
pain
back,
right now?
yeah, my back.
Your
My
back.
back spasms. Back starts twisting, you know, like with the jaw, same movement.
He was having recurrent spasms, and the spells would last about 20, 30 minutes at a time.
Now, right now in your face, are you...
I'm frowning because I can't help it.
You're smiling because you
I'm
can't help it?
frowning because I'm frowning and my teeth is leaving me again.
Okay.
That's what's happening now.
Huh. And how longer is each episode lasting?
It's been about a half hour. I was fine.
Yeah.
And now it's starting to come back again.
Okay. Could you
It's
just look at the
unusual
camera?
to have a generalized acute dystonic reaction.
You want to lie down? That's okay.
Most dystonic reactions are from the neck and above, and they usually involve the
Now, try
jaw,
not
the tongue,
smiling, but looking
the head
serious
turned to
like
one
that.
side.
Can you move your leg? Can you bend it at the knee?
No,
You can't bend it.
not yet. Now I can
But his dystonic reaction involved his spinal musculature, his leg, and interestingly was asymmetric. That's one of the many things about acute dystonia we don't understand. Since your brain is presumably symmetric, why should this sometimes involve one part and not the other? And sometimes it may jump from one side to the other side. Why should it spare one place and not the other? Here he's trying to walk, and you can see the severe torticollis.
Okay, now turn around, look at me. Is your neck twisted?
Mm-hmm.
Just stay like that, just stay right there.
Look at his tongue. That's involuntary that his tongue is stuck out.
I twist it back.
Can you overcome it if you take your hand and push on your chin on
We're
the
asking him
left?
at this point whether he has what we call a geste antagoniste. Patients with dystonia frequently are able to overcome the dystonia just with mild touching. They're not really pushing their heads over.
Oh, hey, they heard me talk a lot. This is great.
In the emergency rooms, it's the nurses who see most of these things, and they're easily recognized. So you see a patient who comes in who's just received Haldol, and their eyes are up like this, and you talk to them, and as they're talking to you, their eyes come down, and then they drift back up again, and they look like this. If you've never seen that before and hadn't read about it, the first thought, I think, has got to be that this is part of their psychosis, in which case, of course, you may be tempted to treat it with more drug that caused it in the first place. So I think the main differential there is psychogenic.
And then in about 2-3 minutes, you'll be all better. Okay?
Okay.
Okay. Try not to jump it.
Uh-huh.
Doesn't hurt much to go in.
So they'll have a flurry of episodes of these things until they're given intravenous diphenhydramine or intravenous benztropine or diazepam, and they go away within a few minutes of getting the drug.
And you feel normal?
Not all the way.
And they're virtually 100% curable with these drugs.
9, 10.
And in what way are you not normal?
I still just feel pain in my neck. That's it.
Okay, but
Like
that's
it's,
it.
Like it's really stiff.
So he was treated with Benadryl, diphenhydramine, and it went away. And he got put on Benadryl for a few days, and it never came back.
Can you open your mouth? Close it again.
Can you tell me what you're experiencing right now?
I'm anxious. I can stop my legs if I concentrate.
Can you describe, do you feel any uncomfortable sensation in your legs?
It's only uncomfortable, it's not painful.
It's uncomfortable.
Yes.
Can you use any descriptive terms for people, who are looking at this? Do you feel restless?
Yes, I feel restless.
Do you get relief by moving around?
Yes.
Now, could you stand and not move?
I can try.
Okay. Up.
I'm standing on one leg.
That makes it easier, huh?
Yes.
Are you moving your toes inside your shoes?
Yes.
Okay. On a scale of 1 to 10, how uncomfortable would you say this is?
7,
And what was it before?
9 or 10. As
Now-
far as just uncomfortable, not painful.
Now here's a difficult, maybe impossible question to answer. How would you compare the discomfort from this, maybe when it was a 9 or 10, compared to the discomfort of the psychiatric illness itself?
Oh. Way above.
Which was worse for you?
This.
This was worse for you than actually having the psychiatric disorder.
Yes.
So you would say that you would rather have been untreated
Yes.
than to have your thoughts under control, but your body this uncomfortable.
Yes.
Now, in general, akathisia is described by the patient as a body restlessness, not a mental restlessness. So patients will describe the worst restlessness as occurring either on their thighs or on their abdomen. So I ask them to point to where it is the worst. And if they point here or here, it's more likely to be akathisia. If they point to their head or can't describe it, somewhat less likely to be akathisia.
If you had to rate it on a scale of 1 to 10, how much would you rate it?
I'd say 8.
About an 8.
Yeah.
Do you sometimes get a 10?
Yeah.
So this isn't as bad as it can be. Okay.
The worst disasters that I've seen from akathisia are disasters like suicide. A completed suicide is obviously a tragedy, especially when it happens from a preventable or reversible side effect such as akathisia.
After a while, it drives you crazy.
It's driving you crazy, these movements?
Yeah.
In my 20 years as a consultant, I've seen maybe 5 cases of what I believe to be akathisia-induced suicide. And there's been a common theme in those suicides that I'd like to warn clinicians of. The first thing is the akathisia is severe. The second thing that I've seen in all cases, it's undiagnosed, and the antipsychotic is raised or continued. And then the third thing that I think is most important in these disasters is the patient doesn't know what's happening to them. They're not given a diagnosis, they're not reassured it's a side effect. So they feel overwhelmed, they feel like they're losing their mind, they feel desperate, they don't know what's happening, and they seem to suicide out of desperation, of feeling horrible and not knowing what's happening and feeling desperate. So a very important part of managing akathisia is to identify the fact that it is a side effect for the patient, reassure the patient it will go away. It's horrible, but it will go away. There's treatment, or we can change medicines or something. That then decreases the terror of the patient feeling like this horrible thing is happening to their body and they don't know what's happening.
It's hard. It's hard for the family too, I guess, not just the one that's having it, but the person that has this is really going through hell. I can understand when people say that someone committed suicide. I can understand how they felt, because at one time I felt that way too. But now, if I get depressed, I don't get depressed nowhere near that as much as I used to.
The things that I think get missed most in the psychiatric population are the slowness and the change in their walking and their posture. Most schizophrenic patients who are treated with neuroleptics don't have significant walking problems or balance problems. even though you may see that they're a little bit stooped and they don't swing their arms so much. Try not to lose your balance. And they may be a little slow, but it doesn't really interfere with their activities all that much. But I'm going to do it harder. And in a sense, you can understand it. If their psychosis is under control and the patient's not complaining about something, terrific. You know, leave well enough alone. You know, why rock the boat? But I think there's a lot of Parkinsonism that goes on that's just not recognized. Or if it is recognized, people say, well, that's the price you have to pay in order to get